Good afternoon and welcome to the Spectral MD Holdings Limited Interim Results Investor Presentation. Throughout this recorded presentation, investors will be in listen-only mode. Questions are encouraged. You can submit at any time via the Q&A tab situated in the right-hand corner of your screen. Just click Q&A, scroll to the bottom, type your question and press send. The company will look to address your questions as we go through today's presentation. However, it may not be in a position to answer every question it receives and review all questions submitted and publish responses where appropriate to do so. Before we begin, we'd like to submit the following poll. I'd now like to hand you over to Niels Vindler, CFO, and Wenchen Fan, CEO. Good afternoon, Wenchen.
Good afternoon, and good afternoon to everybody on the call. Thank you very much for your great interest into Spectral MD. And Niels and I are happy to be here in London to present our interim results for the first half of 2022. And first of all, my name is Wenchen Fan, the CEO and co-founder of the company. And with 20 plus years of managing emerging technologies in AI, imaging, natural speech recognition at all the big and small good companies. And I was among the first to start and join the company. So that's a brief introduction of myself. I would ask Niels Windler, our CFO, to make a brief introduction, please.
Yep. Thank you, Wenchen. My name is Niels Windler. I'm the Chief Financial Officer of Spectral MD. I joined the company last year in November. And prior to Spectral MD, I spent over 20 years in different finance and operations roles for different healthcare and life science companies, including 3M, KCI Facility, Siemens, and Biotronic.
All right. So Spectral MD is a Dallas, Texas-based company, and we specialize in predictive analytics. And we have this great platform technology called DeepView. DeepView, and we specialize in using this platform with our proprietary artificial intelligence to predict a wound will heal or not. That's our current focus for now, and we will grow this into many other beautiful areas for sure. And to quickly talk about our technology, we are a medical imaging AI company. So if you fall into one of those three words, you're part of a critical path for this company, for the Spectral MD. On the upper left, that's the current system of our DeepView imaging system, roaming around hospitals, collecting the clinical research data. This is a patented, proprietary, multispectral imaging data acquisition. And what it does is actually acquire from near UV light through the visible band all the way into the near IR lights within milliseconds. Literally less than 200 milliseconds, we already acquired images from near UV lights, which is very good to study the surface of the wound, and through the visible band all the way into the near IR lights, which penetrate deeper into the tissue. And this wound tissue physiology data, after it's acquired, we don't just show those kind of features. That's not what we do. That's not what DeepView does. Instead, we combine all this raw imaging data along with the patient healthcare matrix data, and then we feed into our AI modeling. And our AI model, the key crown jewel for our things, will be the proprietary, clinically validated database of multi-billion data points. And our algorithm integrate both the image and the clinical data for our AI model training. We go through all these fantastic inventions and disruptive technologies, and to actually present very simple clinical outcomes, a binary outcome, whether a wound will heal or not. For example, on this pictures here, we always show the raw wound on the left. With this, this is a young patient's chest with a very heterogeneous, complex burn wound. And on the right, that's a DeepView output. That's it. We only highlighted the areas where the burn wound will not heal. So doctors, when they look at this kind of results, it will be helping them to decide whether and what they will be doing for the non-healing burns. And the The deal with using the DeepView is actually to try to help to guide the patients, to guide the physicians to make the treatment decisions along with the current treatment flows. For example, in American Burn Association guidelines for how to refer burn patients to the burn centers or not, there are 9 steps, 9 factors to be considered, including many other very age or TBSA and other things that can be easily or somehow measured objectively. But the number 3 is a burn severity assessment. Unfortunately, right now, there's no technology to address that. It's just based upon the physician's observation. And that's what we're trying to fit in to provide that objective and statistically sound clinical assessment of the burn severity. That will give us the better guideline to the physicians for how to basically influence their treatment flow decisions. And for the burn wound, this is one of the burn indication is one of our flagship indications that we're working on. There are close to 500,000 US burn patients visiting the ERs every year, out of which 53,000 will require to be having in-hospital stays. 8.1 days, that's average length of stay, and average cost is $24,000 per stay. This is the current market situation. And the length of stay, LOS, actually accounted for 72% of the patient's cost through their journey. The current situation in the hospital is 50 to 70% diagnostic accuracy from the physicians. 50 to 70%. I know that is actually plenty not good. And at 50% is no better than a coin toss. Even the most experienced, they're at 70%. So we humans are actually very smart. If we see a problem with something, we find a workaround. So what's the current workaround in standard care? We wait. We wait up to 21 days to determine the need for surgery after we can call a burn wound will heal or not. And unfortunately, throughout those many days, the patient will get much higher chance for infections and other complications, not to mention the very high cost for the length of stay during the hospitalization. That's why we developed a DeepView from a small number of clinical sites to a larger number of clinical sites, from small subjects enrollment to many. Now we're sitting on day 1 with an accuracy of 92% to predict a burn wound will heal or not. And that is for adults. For the pediatrics, it's at 88%. Both of these results were presented at American Burn Association annual meeting. And in this way, by retrospective clinical study performed at Louisiana State, this could reduce overall length of stay by over 50% and cost saving of $14,500 per stay. If I show you a slide like this for a business, and that is very, very common. You have a market, you have a problem, then you have the solution. This is a very normal situation here in the pitch, in the presentation. However, what's unique for Spectral MD is what you see in front of your eyes. These are all well supported for the past 9 years by a now total over 125 million US federal government contract. What do you see in front of you? This is a result of a spending over 70 million US dollars of affiliation from that. And in the current contract, we still have more than $40 million to utilize. And hopefully, once we get all this done right, we will be qualified to receive the commercial side of a federal procurement and deployment type of contract in the near future. So that is for burn indication. So why are we looking at diabetic foot ulcer as well? Because these are very similar problems with a much larger market. 5.2 million DFU patients per year. That is 10 times of the burn patients per year. This is only in the US, UK, and EU4. 15.5 visits per year costs up to 63,000 DFU patients per year. That's the current market situation. And the problem is that no diagnostics available. Our workaround as human, 30 days minimum of standard wound care for all DFUs. Unfortunate fact is 40% of that 5.2 million will not respond, and they would have required advanced therapy or revascularization anyways. I was at one of the hospital, one of our sites, talking to the doctors after they showcased all their great advanced wound care products and other things that could have helped many of the DFU patients recover sooner. I said, Doc, why aren't you using all these great products and great things to all DFU patients from day one? And he looked at me, he says, because we can't. We're not going to get paid for that. We have to take the patients through a journey of 30 days minimum, some even 45 days, in order for us to declare it's a non-healing DFU and the insurance will pay for the advanced wound care product. Then he looked at me, he paused and he looked at me, he said, hey, wait a minute, isn't that what DeepView is supposed to do? That's a value proposition. I said, exactly right, but I want to hear you to say it out loud once. So DFU, we are now sitting at a trending study results of day one at 81% accuracy to predict whether a DFU will close over 50% or not in 4 to 6 weeks. This provides a quicker time to advance therapy, better wound healing, and reduce overall hospital utilization. That's what in DFU. And for the, there you go. So for the business, for the commercial business model, and for the DeepView in burn, and what we're looking at is the next level with our federal sponsor and with a well-established pathway for companies like us to go with a commercialization type of contract for federal procurement and deployment. That's what we're going to do with a one-time sell, capital cost sell to the US government and work with the USG to deploy our technology as a part of a mass casualty countermeasure into the US ERs and hospitals with burn centers. And for the diabetic foot ulcer, well, the burn is inpatient, the DFU is outpatient service most commonly for the wound care clinics, podiatrist office, and all those kind of things. Luckily, our system costs allow us to provide the system at a very low initial price or in a leasing model for the system while we work out an annual licensing arrangement with the caregivers. And with existing lower extremity examination codes and things in that nature, we hope, we wish, we believe, and we can actually work out with the wound care clinics on a very self-supporting plan to have this implemented to have a low-cost entry using our systems. So to recap, for the burn, we're going to work with the US government on the federal procurement deployment type of contracts in the future and use that methodology to reach out to the many ERs and hospitals and burn centers. For the DFU, we are going to do a system plus a software as a service, a SaaS model to actually collecting the revenue in that fashion. And that's our commercialization strategy for both the burn and the diabetic foot ulcer. With these two substantial high growth wound healing diagnostic market opportunities we have been focusing on, and we're also focusing both in the US, UK/EU as well. And we have received the FDA breakthrough designation for our burn indication since 2018. And we work on a robust, ready to execute commercialization strategy. That is a quick intro from me to you folks. And now I would turn the floor to Niels, our CFO, to present you with our interim report for 2022. Niels, please.
Thank you, Wencheng. Yeah, looking at the first half of 2022, looking at the burn applications. And again, the burn application is what is funded through the US government, through the Biomedical Advanced Research and Development Agency of the United States. We're currently enrolling in our burn AI training study. The enrollment is going extremely well. We're very, very satisfied with the results. By June 30th, we had 68% of the 250 subjects enrolled, continue enrolling strongly. That gives us great confidence in meeting that milestone that by the end of this year, early next year, we have the enrollment for the study finished. We also performed other studies. One is the burn image assessment study, the so-called BIAS study. And what that is at burn conferences, we ask burn specialists and ED physicians to take a look at a picture of a burn and highlight the areas where they would perform surgery on. So in other words, to determine what areas of the wound they see in front of them is healing versus non-healing. We then compare that to the results of the machine, and we found out in those studies that burn specialists as well as ED physicians are significantly less accurate in determining what part of the wound has the potential to heal and not. So that is a big outcome for us, which just undermines our thesis the whole time, and will also be very, very beneficial for us as we go through the regulatory approval process. Looking at the DFU application, again is we raised roughly 15 million last year at the AIM market during our IPO to fund the development and commercialization of our DFU application. After finishing the training study last year in December, we successfully created the AI model with 81% accuracy, and then successfully initiated the validation study in June this year. And we're already at 56 subjects enrolled. So also this enrollment is going great and is very strong. And we're very, very confident to also here, in this case, for the DFU validation study to be able to hit the milestone, meaning finish enrollment by the end of the year, which then puts us in a good position for the next milestone for the DFU application, which would be the regulatory submission in 2023. Those are the US activities. We're also, as Wensheng mentioned already, we're also focused on outside of the US, specifically the UK and the European Union. We signed an important collaboration agreements here with prominent institutions in order to get the clinical studies that we need to conduct in the UK and European Union going. There will be more news later coming this year. From an organizational perspective, we are very happy and delighted and thankful that we won in the Best Technology category of the European Mediscience Awards. That is a big accomplishment for us. One of the criteria for this award is it had to be well funded and have a very, very high likelihood of commercial success, capability of success. We met those criteria. We're very, very proud of it. So thank you again. We continue to strengthen our organization by filling key positions. Two of them, just to name them, we filled the position of the VP of Marketing and Commercialization, Christine Marks, a great addition to the team. We're working now with Christine on preparing for commercialization, go-to-market, branding, reimbursement, and all the things that come along with it to develop a detailed plan of action. We also got a general counsel on board, Vince Capone, with a lot of relevant experience for our business. But besides those two roles, we also continue to grow and fill positions in other areas of the company. Now, obviously, engineering and R&D, but also other very, very important administrative functions like regulatory, quality. And we will continue to do that as we're preparing for the commercialization of our DFU application in 2023, as well as a potential procurement, federal procurement and deployment contract currently believed to happen in 2024. Following the 1-year anniversary on the AIM market, the Reg S trading the restriction was removed as expected. And we also worked on expanding our research coverage out there in the market. We were covered by SP Angel so far. We added Stifel, and lately, that is a post-period highlight, also WH Ireland. Taking a look at the financials for the first half of 2022, I'm very happy to report to the market that we closed the first half with a strong cash position of 15.6 million. That allows us, given the current milestones we have ahead of us that we were laying out, we are fully funded through this year and the end of next year. From a revenue perspective, you might ask yourself how you're an R&D company, how can you have revenue? What that is so-called grant revenue. The mechanism that we get funded through BARDA is the following. For every dollar that we submit in form of an invoice to BARDA, so those are costs that we incurred that are related to the research and development of the burn application, that gets billed to BARDA with a 55% markup. So in other terms, for every dollar spent, BARDA reimburses us $1.55, and that shows on our P&L, shows up as revenue. So you see here, year over year, 21 versus 22 versus 2022 versus 2021, you see a 76% increase. So that is the result of increased R&D activity and increased R&D spend that we did to drive our milestones further. You see the same picture similar in our expenses. Those went up significantly from 7.9 million to 12.8 million. Again, a result of increased R&D activity for burn, where we get the reimbursement from BARDA, but also increased R&D activity for our DFU application, where we don't have an offsetting impact in revenue yet, until we're commercial and sell our products out there. Looking forward a little bit for this in the second half of 2022, we're expecting that picture to continue from a revenue perspective, but we will see an increase in expenses above the first half of this year as we're keep enrolling and in our DFU validation study. So we will end up with higher expenses in the second half compared to the first half. From a profitability perspective, we ended the year almost around the same area where last year. Last year, we're at adjusted EBITDA minus 200,000. This year, we're at 200,000. What this slide here also shows very nicely is, and when Cheng talked about it earlier, if it would only be the burn application that we were doing, again, that is the BARDA funding, where we get the markup, we would be profitable, as you can see here in 2020. As we became public in 2021, we incurred more expenses for being a public company, and secondly, we also started the expenses for the DFU development. That drove the negative result of EBITDA in 2021. Will drive a negative EBITDA result in 2022 by design. We're anticipating once we are have it commercially launched the DFU application, we will be back to EBITDA positive. From a post period highlight perspective, very, very exciting news for the company. We received another funding from BARDA. It's an expansion of our current contract, which now brings, when you look at all of the contract awards from BARDA and other government agencies, we're now over 125 million of US government funding. This is very, very exciting news for us because it's a clear sign from BARDA that they really working on accelerating the pathway to commercialization of our burn application. Why is that? The 8.2 million, a part of it is meant to be able to enroll patients in more clinical sites, which is fantastic and great, driving better clinical outcomes. But even more importantly, the 8 million are also meant to ensure the interoperability of our system with the electronic healthcare record system of the hospitals in the United States. That is a very, very important and must do in order to be commercially successful. BARDA knows that, we know that, and BARDA is now at this point where they're saying like, all right, you get this done. Secondly, or thirdly, last piece of this funding is meant to ramp up and then get our contract manufacturer ready to be able to produce a capacity of 1,000 to 1,200 units per year. Again, yet another sign from BARDA to say like, let's get ready. Let's put the, as we like to say, let's put the pedal to the metal here. So great signs from BARDA. We're very, very excited. Since we closed the half year, we continued with strong enrollment, both on the burn side and on the DFU side. And we continue to accelerate filling key positions in our organization. And yeah, we're also in the meantime following the lifting of the Reg S restriction. We're also happy to announce that we're listed on 5 major trading sites in the United Kingdom. So that's fantastic news, as the Reg S restriction was always not the most favorable situation to be in. Summary and outlook. This is a slide that just summarizes our future milestones. We laid this out in the major milestones here: steps, burn application, DFU application, handheld device, and horizon application. Horizon application is an application beyond what we're currently doing, so beyond DFU and burns. For burn, we talked about it. We're looking forward to receiving a federal procurement and deployment contract in the realm of over 400 million in 2024, with following commercialization of our burn application in the United Kingdom as well as the European Union. For the DFU, we're getting ready to submit our regulatory clearance in 2023 with a targeted launch of the product by end of 2023, and then quickly followed with commercialization again in the United Kingdom and European Union. We're also, BARDA is not the only government agency that is funding us. We're also funded by the US military, who is very interested in developing a handheld device of our imaging system. Basically the same system, but in handheld form that can be deployed in the far-field use. We're also happy to announce here that we made great progress with our current funding, and we have a working prototype. So we're looking forward into the rest of 22 and 2023 to push that further, and there will be more to come on this front, I think, very, very soon. Last but not least, I just want to give an outlook and understanding of where Spectral MD is right now and where we potentially want to go. So this slide lays out the wound therapy. As usually it starts with a prevention, which means hopefully it's not even happening. If it happens, a diagnosis takes place, then someone makes a treatment decision, then an actual treatment, an actual therapy is applied that can either be standard therapy or advanced wound care therapy. And then the therapy ends usually with a follow-up. So as we pointed out at the beginning, we are a diagnosis company. So we're diagnosing if DFUs or burns will heal, yes or no. So it is a clinically meaningful binary decision. We're helping to make a decision. We will be in burn centers, ERs, EDs, wound care centers, and hospitals. So now looking into the future, other indications can be added to the platform of our imaging device, such as VLU, CLI, so amputations. And when you look at the sites of service, we're not limited to the ones we're currently targeting. It can be med clinics, primary care, plastic surgery, dermatology, or even home use. If you think about, especially for chronic wounds like the DFU, having a home use device at home for the sake of prevention can be very, very powerful. Right now, as I said, we just had the determination, yes or no. Is it healing? Yes or no. Going forward, we might be able to also predict the potential of the wound healing potential in combination with like what kind of therapy is the most likely to be successful. Is it surgery? Is it advanced negative pressure wound therapy? Those are possibilities as we're collecting data and as we're growing our very, very significant clinically validated wound database. We're not in the business of competing with medical device companies. We're not planning, nor is that in our horizon, to provide advanced wound care solutions. But are there potential partnerships with those companies on the horizon? Absolutely. And then last but not least, when you look at the cadence of the therapy, at the end of the therapy, when it comes to evaluating the therapy efficiency, as well as supporting the reimbursement process, we see that our device, especially when you think about applications like wound measurement, might have a great potential for the future. This all in parallel is in the works on our horizon while we're miniaturizing our currently card-based device, as I mentioned earlier, through the Department of Defense funding. You see here on this slide, on the top left, you see our current device, and on the top left, bottom left, you see our current prototype, which is in fact a handheld device. So overall, we're making great progress. We hit our milestones. We are, from a revenue, expense, and cash position, in a very, very strong position. So we, as management of Spectral MD, looking forward to the next milestones, the end of 2021, and are very excited about the year 2023. And that's
fantastic. Thank you, Niels. And like Niels just went through all the financial highlights, both for the first half of 2022 and some post-period highlights. I think in summary, the company is on its pathway for both a burn and for DFU as we planned. We are delivering our milestones in time, on time, and we're executing our plan very, very efficiently from both the task executions, milestones, as well as our financial responsibilities. I think that's a current status of Spectral MD. I think throughout our presentation, we already answered the many questions coming through from the audience, and those are very well covered already, I believe. If there are no more any other further questions, I think this will be the end of our interim report for first half 2022. Thank you guys very much. We appreciate your continuous support of Spectral MD, and we wish you a great evening.
Fantastic, Wensheng. Thank you very much indeed. And of course, any further questions that do come through, the team will be able to review those, and we can publish responses where appropriate to do so on the Investor Meet Company platform. Indeed, Niels, Wensheng, thank you for updating investors today. Can I please ask investors not to close the session? You'll be automatically redirected to provide your feedback in order the management can better understand your views and expectations. It's only take a few moments to complete, and those greatly valued by the company. On behalf of the team at Spectral MD Holdings Limited, I'd like to thank you very much for attending today's presentation. That concludes today's session. Thank you and good afternoon to you all.